Good morning. Welcome to this morning's call with the Office of Minnesota Governor Tim Walz and Lieutenant Governor Peggy Flanagan. I'm John Pratt, Executive Director of the Minnesota Council of Nonprofits, and we're grateful to sponsor this opportunity to hear directly from administration leaders, today including the Governor, Lieutenant Governor, plus Human Services Commissioner Jody Harpstead and Commissioner Peter Grove of the Department of Employment and Economic Development. We'll be joined by the Governor at about 11:35. We have 300 participants registered for this third of 4 weekly briefings with the Governor's Office. When this call was announced, we put out a call for questions, and MCN's Public Policy Director Marie Ellis and Minnesota Budget Project Director Nan Madden organized the questions, shared them with the Governor's Office, and Marie Ellis will present them during the last half of this call. We have up to an hour for the call, and our agenda is to first hear from the Governor at about 11:35 about the current situation. Nan Madden, Director of the Minnesota Budget Project, and I will give an update on nonprofit and community impacts and what we've heard from our members about what is still needed. Please note that the Governor has limited time and will need to move on to another call partway through this briefing. Lieutenant Governor Flanagan and Commissioners Harpstead and Grove will remain on this call to make further comments and respond to questions. Lieutenant Governor Flanagan will provide an overview of the work that the Office of the Governor and Lieutenant Governor are prioritizing. Commissioner Harpstead will give remarks about changes in DHS's work during the pandemic. And finally, Commissioner Grove will provide information about DEED's areas of focus, available funding, and what the past few weeks have looked like. The final section will be a Q&A using the questions submitted previously. There is also a chat function if you want to post questions. Note that we won't be able to get to all of them. So a big thank you again to Governor Walz for being available for these calls. Over to you. I think we're but it may be a few more minutes before we're joined by Governor Walz. Let me mention a couple of the issues MCN has also been working on. This past Wednesday, we did a briefing on the payroll protection program. Had over 400 nonprofits participating and over 200 questions. So clearly, like other employers, nonprofits are looking at how to sort of get past the closures and deal with sort of financing their organizations during this time. One big question still is hanging out there is about applications for forgiveness. Clearly, one of the most valuable parts of the payroll protection program is having forgivable loans to help cover this payroll in the summer and spring. So and we'll be working with organizations including Propel Nonprofits and Sunrise Banks to get information out and sort of follow the Small Business Administration's directions around how people will obtain these as forgivable loans. Okay, the Governor's on the call now, so Governor Walz, thank you. Over to you.
Thank you, John, and good morning, everyone. And I hope everyone had at least a somewhat restful weekend or Easter if you celebrated or Passover. Thanks again for all the incredible work. Today I'm going to be joined by Lieutenant Governor Flanagan, Commissioners Harpstead and Grove, and again, listening there for a little bit, understanding all of the challenges that you're all going through. We want to make sure that we're first and foremost protecting Minnesotans, but I can assure you we are spending considerable amount of time on what it looks like to pick up the pieces, how do we keep people as whole as possible, and a clear understanding of the work that you're doing is all part of the care now, the recovery, and the long-term well-being of the state. So we too are thinking about ways to continue to advocate for moving resources to you. We're working closely with our federal delegation as Stimulus 5 is being talked about. And just to be very clear, the holdup is of the belief that states and local governments need to have, and we've advocated, I just got off a call with Vice President Pence and the 42 other governors asking for $500 billion, that then the state would have the capacity to directly move as appropriations to many of your organizations or to other entities in county and city government. It's going to be the only way we're able to do this. And again, loans are not going to be the way to do it. We're going to need that stimulus that goes in. So I want you to know how seriously we're taking that. And the state is still continuing to pursue an active strategy of slowing mitigation or slowing the spread of this disease through the mitigation that we've taken. We are confident that we are building surge capacity in our healthcare system, still being hampered by a shortage. I think some of the numbers prior to COVID-19, if you would have looked in December, our hospitals across the state would have been using between 3 and 5 million N95 masks a month. We're going to need about 120 million to be able to do that. So you start to see the magnitude of where we got behind on the PPE, and we're very convinced that the way to get out of this is through extensive testing, both antibody testing and testing initially for the disease, continuing to trace, and then quarantine and isolate those that are most susceptible or those who are being infected. On a wide scale, we think that is a way that you can begin to open up in a strategic manner, open the economy up as quickly as possible. I would be remiss if I didn't say I'm still disappointed that there is no national strategy to do this, but I can tell you that speaking with Governors Whitmer, Evers, DeWine, and others in the upper Midwest this morning, there's a desire to then at least to do it regionally. And that would be looping in the states that have chosen to take a different approach, like Iowa and Nebraska and the Dakotas, of looping them into a massive testing surveillance program that allows us to do that. So I want to assure you that we are looking at what that moonshot looks like, pushing us closer to the day that we get a vaccine, but with an understanding we're going to keep coming back through this again and again. So I know the biggest concern right now is, of course, safety of the people that you care about, both family, friends, and the folks you work for. The financial stability piece is critically important to us too. So I want to assure you, you'll have Commissioner Grove on, Commissioner Harpstead, and of course, the Lieutenant Governor to talk a little bit more in detail on that. But I'm going to hang on here for just a few minutes before I get on another call. But the one thing I'll remind Minnesotans about, I'd remind you all about, I think there's definitely reasons to be optimistic looking across the country, but I caution all of us, if it feels like we passed a surge because New York City did, or they're at a plateau, we're just not there yet. We will get there, and hopefully not as bad because we prepared better. But I just hope that there's a psychological effect that goes in. It appears like things are somewhat stabilizing in New York, which it appears like they are. They're several weeks or potentially months ahead of us because of the work we've done. It doesn't mean that we'll ever get to that point, but the potential is still there. So I'd ask all of us to keep that in mind. And so I would, John, turn it back to you and Nan, and I'll hang around here for a little while.
Right. Thank you, Governor. And definitely appreciate both the caution about what's happening with the public health crisis and the importance of state and local government, and including financing. And absolutely, we want to see the federal government step in and be the resource it can in a very different financial picture from state government. So you definitely have support from a broad part of the nonprofit sector for that. And certainly nonprofits are affected like other employers. And we're seeing, we've seen the program closures, facilities closed, performance and classes canceled, very large layoffs, and very difficult situation, and some very grim situations in organizations' finances. So we were grateful that the CARES Act did pay close attention to including nonprofits. There's still some sort of missing pieces there. And also the economic injury disaster loan. So we did a call on Friday with Senator Smith and the acting director of the SBA Minnesota office, and clearly there's a lot of activity and nonprofits want to be included, and want to see additional funding for that program. It's been great to see additional flexibility from state departments and now also from the AG's office and the IRS around reporting, moving back deadlines. These are essential community resources, and clearly organizations are strapped at this point. And then high expectations around phase 4, both how it will address some of the things left out in the original CARES Act, the 500 plus employee organizations, the half of the unemployment compensation for reimbursing employers, financial losses. And then clearly the biggest impact is just on individuals in the state who are hurting economically and with this isolation. So Nan, I'll ask you to talk more about sort of some of those community impacts in the next phase of federal response.
Great, thank you, John, and hello everyone on the call. I'm going to touch on some of the tax and budget and economic policy issues of this moment that we're in. I want to start by thanking Governor Walz, Lieutenant Governor Flanagan, and your administration. We have been calling for an inclusive response that addresses both the health and economic security needs of Minnesotans, and I know the administration has been guided by similar themes. We appreciate that there have been many important steps at the state and federal level to provide resources to jobless workers, to individuals and families, to employers, and as you mentioned, the federal funds for state and local governments and tribal nations. But we know that still there are too many of our neighbors being left out, including communities of color and lower income people, and that there's more to do for the policy response to reach the scale needed for the size of the challenge in front of us. Some of the immediate state level priorities that we would like to lift up are enacting the $500 emergency payment for the very low income parents and children participating in MFIP, and I know the administration has been supporting that. We know that many of those parents have worked in the industries that are most impacted by the current crisis, yet many will not qualify for unemployment insurance. Secondly, making sure that every Minnesotan has access to the healthcare and other services that they need. We've support efforts calling for more information to be available in multiple language, and also for the state to take action to fill in gaps for the ways that the federal government often specifically leaves out immigrants and their families from some of their legislative action. Third, we've really appreciated the steps you've taken to provide flexibility and financial support to the child care system. We know that was a fragile system even before COVID hit, so we look forward to continuing to work with you to address underinvestment in affordable child care. Finally, I'd like to note there's growing awareness that in addition to the public health crisis and the economic disruption caused as we take those necessary public health measures, there is an emerging fiscal crisis in the states, excuse me, as you mentioned, Governor Walz. But we can't let the state's worsening budget situation stop us from taking the actions needed to ensure that all of our neighbors can get through these tough times and to set the stage for a more equitable Minnesota when we get through all of this. So I appreciate the attention the governor is paying right now and the advocacy for additional federal funds. That's so important in these times. Also appreciate that Minnesota has built a strong budget reserve that will serve us well as we go through this crisis. But before too long here, I think Minnesota and all other states are going to need to look to their own revenue systems, excuse me, and see what needs to be done there to make sure they have the resources to meet the needs of their residents. Thank you, and thank you for the time.
Thanks, Nan. And Lieutenant Governor Flanagan, thank you. You've been a part of this response every step of the way and each of these calls. We really appreciate your availability today.
Well, it's my pleasure to speak with all of you, and thank you for the opportunity to have the governor and I on this call once again. And I just want to also just lift up, really lift up what Nan just said, because I think, you know, these are the very proposals that we can really lean into as an administration. And I'll just be very candid with all of you. The Senate GOP, they should be ready and willing to do these things, because we are, and I think the governor would sign them into law. I do want to lift up specifically, Nan, your comments around TANF and MFIP funding. That proposal in particular, as the money already exists, is frustrating, but I have appreciated the advocacy from nonprofits, and in particular Liz Coopola's opinion piece in the Star Tribune, really painting the picture about these families and what that money would mean for them. So we will continue to lift up those issues and want to amplify all of you as much as possible, because that is on our hearts and minds in this moment. Additionally, you know, I think I want to just go a little bit further into the weeds and share how we're tracking the impact of the virus on communities of color, immigrant and refugee communities, Indigenous communities, in order to craft culturally appropriate responses to this public health crisis. I don't need to tell all of you how pervasive racial inequities are in our community, and really that the virus has laid those quite bare for all of us to see. These health disparities exist, and they mean that people of color are more likely to have underlying conditions, which means they are more at risk for falling critically ill when they get sick, and that these economic disparities also exist, and that our communities are likely to be uninsured or underinsured and have lower incomes, which means they are more financially at risk for when they get sick. We see other communities like Milwaukee, the African-American community and residents are the ones who are getting sick, hospitalized, and dying at higher rates, that this is really the potential for that to happen in the Twin Cities is very real. And that's why we've taken a proactive approach to tracking the impact of the virus on communities of color and developing means to respond to this as well. First, we have disaggregated the data by race of people who test positive, folks who are hospitalized as well, and who require an ICU bed, and those who have died from the virus. Second, we are tracking, and that information is available on the dashboard on our COVID-19 response website. Second, we track over time the change in rates of infection and hospitalization to see if a community is being disproportionately impacted. And while our data shows that those currently falling critically ill, and in some cases fatally ill, are largely white residents of long-term care facilities, we know that the caregivers in many of those facilities are primarily people of color. So we're monitoring really closely to see if the virus moves to healthcare providers, and are working around the clock to secure protective equipment, PPE, so things like masks and gowns and gloves, so they can continue the important work of caregiving while also staying safe. The third, the resources allocated with the state legislature to the Department of Health to fight COVID. We've set aside $750,000 in grants to go to organizations in specific communities to be trusted resources of information and to support their community. And we currently plan to grant another $750,000 of new resources to culturally specific news outlets, so that trusted messengers can relay important information during this time of really rapidly evolving information. I have also been doing additional interviews with folks in those outlets, and will continue to do so. We really, and the governor's made this clear as well, but we intend to make data-driven decisions about future resources and want to be nimble if the virus begins to have a disproportionate impact on a particular community, which is why partnering with many of you in community-based organizations is so important right now. We directed all of our agencies to work closely with you and to be as flexible as possible for us to get through this challenging time together. And I know that Commissioners Harpstead and Grove are on the call. They're ready to talk about some of that flexibility and grant programs and highlight the income support work that we're doing through both of these agencies. DEED is making progress in supporting businesses owned by diverse entrepreneurs, and DEED has reported that over 50% of the small business loans that have been made with the COVID resources are owned by people of color. We encourage other businesses to take advantage of these 0% loans to help navigate these challenging times. And we're really grateful for those of you who provide technical assistance for businesses applying for these funds in this moment. I know many of you are similarly working to address the racial disparities in our community, and I'm grateful for your commitment to equity and that it shows up in your work so that your resources can be used wisely. When the governor said that the state of the state is strong, resilient, and united, it is really large part due to the strength and resilience of our nonprofit community, and I'm grateful for all you do and look forward to our conversation for the rest of the morning today. But also, again, just want to reiterate that these disparities that we see, they are incredibly upsetting, and we need to make sure that we are doing a good job of sharing with you the work that we are doing internally in our agencies, but also amplifying the messages coming from all of you to ensure that we are not leaving anyone behind during this time. And especially, and I'm glad that Nan mentioned this as well, as we are looking to how we emerge from this recovery, this challenge and the heartbreak of COVID-19 also presents us with a really important opportunity to no longer do business as usual and really center the most vulnerable members of our community in these conversations and the way that we do recovery, to not further exacerbate disparities and leave folks behind. So we look to all of you to help us to do that work. Commissioner Harpstead is back with me today from DHS, and she's going to share some remarks about how DHS is leading through this time. And then we'll turn it over to Commissioner Steve Grove from DEED. And then I'm happy to go through some of the questions that folks have submitted as well. So Commissioner Harpstead.
Hello, can you hear me?
Yes.
Okay, thank you. So first of all, thank you. We've made over 30 decisions now under Executive Order 2012 to flex rules to maintain Minnesotans on Medicaid and Minnesota Care health coverage, MFIP, and other programs, and without having to have them reviewed or reauthorized, and without having the providers have to redetermine or re-up for those programs. We've included tele-everything as much as we can across all of our programs. We have one major telemedicine, not proposal anymore, a decision by the federal government for licensed providers. We have another one awaiting federal approval for qualified providers and group therapy. I'm pleased to say that we have had for the last several weeks now an at-risk populations work group working across state agencies. This one is particularly with the Department of Human Services and Minnesota Housing, raising visibility to populations living in non-medical congregate care and receiving home care, and people at risk of prolonged stay at home, which includes 40% of our Minnesota Health Plan participants who have a diagnosis of mental illness, substance use disorder, seniors with depression, families with supportive child protection, or at risk of domestic violence. Many of these efforts, of course, already focus on communities of color and Indigenous people. Our Chief Equity Officer, Karen McKinney, is at all of our decision meetings. She is straight from the community and new to state government, so she asks very tough questions, and we really appreciate the challenges that she's putting before us as we consider all of the decisions we're making. More comments later on the questions and answers. Commissioner Grove.
Great, thanks, Commissioner Harpstead. Hello, everybody. Thanks for allowing me to join this call today. Eager to hear your questions. I'll give a few comments up top, and then we'll dive into them. I think, first of all, I just wanted to echo the gratitude that the Lieutenant Governor and Governor and Commissioner Harpstead have expressed for the great work that you're doing across this state. State government is but one lever to help a community and a society respond to such a unprecedented time, and we're very, very fortunate in this state to have an incredibly kind, giving, thoughtful, and sharp nonprofit community that is walking hand in hand with us as we meet the needs of those most vulnerable in our society. At our department here at DEED, of course, the first big program that we needed to activate and engage for all of the folks in Minnesota who are separated from work is unemployment insurance, which, you know, certainly 85 years ago when it was created, it was not created with the idea that it would need to respond to essentially the entire economy being put on pause. But that's what it has had to do over the past week, month rather, and we have seen in the past 4 weeks almost double the number of applications for unemployment insurance in this period of time than we saw in all of 2019. So the numbers are really staggering. We're up to about 430,000 applications for unemployment insurance. We know that affects people of color more than it affects others. 19% of the labor force that is people of color, Indigenous, or Latinx are currently filing for unemployment compared to about 9.5% of the white working population. So we're tracking those numbers very carefully and looking for other support mechanisms we can put into play. And also just making sure that the system works. We've had to expand our staff significantly, open up our application lines on the weekends, hire more call center individuals, create more server capacity to take in that load. We get about 8,000 phone calls a day, which is unprecedented. Usually wait times are under 30 seconds. They're now over an hour, which we're actually proud of, even though it seems extraordinary. But to keep it in that time zone is actually a win given the circumstances. And the governor has moved very quickly to create the right executive orders to ensure that these benefits can go out quickly, not only to make anybody who's affected by COVID-19 eligible for UI, but also to clear up some hurdles that are common eligibility flags in our system, such that those who are not getting unemployment insurance because of a slight technical issue on their account as it relates to paid time off or other types of benefits they're receiving can just be cleared right away. And so you've seen the governor put those executive orders out into the market over the past few weeks, and it's just been a huge win for us as a state to move more quickly than many of our neighbors because of that fast action by Governor Walz. So we're grateful for that, but we also know there's a lot of people who are hurting and a lot of people who aren't getting those benefits and whose applications are not yielding them the results that they expected or wanted to hear. And so we are doing everything we can to provide clarity on how this program works, because 85% of the people applying have never even had to use it before, and just a lot of generosity and fairness in how we administer it. And so that's really been just a major focus for us, obviously, as it relates to just helping individual workers who are separated from their jobs, whether those jobs be at businesses or nonprofits or what have you. And then the second area of focus has been on how we help small businesses weather this time as well. And the first move that we had to make there was just getting the Small Business Administration loans available in Minnesota. We have qualified amongst the first tranche of states who were able to do so, and the Paycheck Protection Program and other levers the SBA has put forth in the last few weeks have helped further. I know for many nonprofits and for many small businesses, the process has been a little complex, and we're working to make sure that just from a communication standpoint, we're clear about how it works with the nonprofits and businesses in our state. Of course, it is a federal program, so we don't run it here at DEED, but we want to make sure that nonprofits and businesses understand what they're eligible for and how to go about the process of applying. We do have some state programs that we have put forth. The Lieutenant Governor mentioned that just a moment ago. We have a small business emergency loan program that we created specifically for those businesses who were affected by Executive Orders 2004 and 2008 to help them get through this time more effectively and to get money to them more quickly than maybe the federal programs could. And it's limited. It's $30 million, and it's 50% forgivable. And we've already given out, I want to say, 8 or 9 million there, about 170 businesses so far. It works through lenders across the state, nonprofit lenders who apply. And we at DEED, as soon as those applications come through that nonprofit lender network, we are able to process and get the money out within 36 hours. So we're moving fast at DEED. We've got a lot of nonprofit partners who are helping us get this right across the state. It's never fast enough and it's never enough. There's no question about that, but we're doing everything we can to make it as fast and as much as we can. And I think for a lot of these programs, it's, you know, state money is helpful. We need to get state money engaged. But of course, the federal government's resources dwarf anything that we as a state government could create. And so one of our big areas of focus is just how do we take advantage of those federal benefits as quick as possible for our state and use the taxpayer money that we have available to us that is, you know, in a more constrained budgetary landscape than a federal government has, and use those monies wisely. So, you know, in addition to the SBA money, we've moved very quickly on expanding some of the federal benefits for unemployment insurance. We were the first state in the country last week to issue those additional $600 per week payments that the CARES Act passed. And we are working very hard right now on the additional benefits as it relates to the 13-week extension for unemployment insurance and the pandemic unemployment insurance for self-employed and independent contractors who are not usually covered by unemployment insurance. Incredibly complex program. No state's actually launched it yet, but our team is very, very hard at work at building out the infrastructure to get that right, and of course, prevent fraud so that our trust fund remains protected and can help Minnesota businesses and workers for as long as possible. So that's sort of a little bit of an update from DEED. We, I guess maybe the last thing just to share is that there are partners on this call, I'm sure, who are grantees of DEEDs, and we're grateful for those partnerships. And as you've probably seen in the past few weeks, we put out guidance regarding how we can help you during this time, because we know some of the work that you would traditionally do in workforce development isn't possible in the same way. And so we've been inspired by the innovation that many of you have shown in providing services remotely or virtually or via video conference or forums like this. And where it makes sense for you to for us to change a little bit of the guidelines that we have for when your payments come out based on the work that you've done, we're being flexible on that front. And in some cases, if it does make sense for cash advances, trying to be flexible there too. So we do a community call 3 times a week with nonprofit and advocate leaders that are related to DEED at 4 o'clock on, I think, Monday, Wednesday, and Thursday. So we'll continue to do those calls as well, and would love to join this forum as often as we can be useful too. So again, thanks for having us on, and eager to answer your questions.
Thank you, Commissioner Grove. And I will put the number for that 3 times a week call in the chat in just a few minutes as well, so everyone has access to that. This is Marie Ellis. I'm Public Policy Director at the Minnesota Council of Nonprofits. I want to thank all of our speakers today for using their time to speak with MCN and nonprofits around the state. I've been able to work with your staff in the governor's office and at DHS and DEED in the last few weeks. And I just want to say that I am across the board consistently impressed with the work that your staff are doing. They are under a tremendous amount of pressure and handling it very well. So please thank all of them for us. As you all know, we collected questions from nonprofits throughout the state last week, and we'll pose as many of them as we can now. I will note that some are similar to questions we've asked previously, in part because there are new people on each call, and in part because a lot of things have changed since the first time we did this 2 weeks ago. This first question is actually from MCN. We have heard from nonprofits who have important priorities that they feel are not getting the necessary attention and traction from policymakers. What is the best way for nonprofits to get information to your administration about their issues and priorities?
So that's a great question. And I wanted to start off by saying that if your organization is not hearing back from our office, this is a chance for us to do better. We will. In this time when everyone's anxiety is high and many of us are struggling, feeling unheard or unseen is really particularly difficult right now. We're working hard to address as much as we can and know that we will not be able to give every issue the attention it deserves. But for the most part, while our office is teleworking like many of you, we are doing our best to continue working through our normal channels. So the best way to raise an issue for us is with staff. So call or email our policy team or our public engagement team. And I know that Marie is, as she just mentioned, is deeply connected to our administration and can also help you get the connection and the numbers and the people that you need. There's also an opportunity, I think, to send an electronic one-pager, hold a quick call or a Zoom meeting. And if you don't receive an answer when you reach out, know that we are not ignoring you. Please reach out again. This is a strange time for all of us, and we are all finding new rhythms, and this process has been new for us too. And I just, many of you know that the governor and I are extroverts, and so not being able to really be in community right now and hearing directly from folks has been certainly something that is challenging for all of us. But more broadly, I would say also as you're looking to raise these issues with your legislators to do the same. And I think, as I mentioned previously, Liz Coapola's op-ed in the Star Tribune was powerful. I think that there are other mediums and platforms that folks can use also to lift up those concerns in a public forum, and would encourage folks to do that as well.
Excellent, thank you. I forgot my unmute button there for a second. I asked this question last week, and Lieutenant Governor Flanagan noted that it would be a great question for Commissioner Grove, so asking it again. To protect Minnesotans, we've seen school, healthcare, work, and entertainment move online. That's great for those who have adequate broadband, devices, and skills to use it. What could be done to increase access to devices, skills, and especially broadband in rural areas? And the writer of that question notes that internet providers do have low-income programs, but that only affects the 69% of rural homes with access to the 2026 speed goals.
Well, that is a great question. You know, I think the governor and lieutenant governor have, from the beginning of their campaign, made broadband a major priority of this administration, and that's why we fought so hard to get additional funding for our border-to-border broadband program last session to ensure that we could put more lines in the ground. And I'll say that we had a record number of applicants from telecoms this year. We had over $70 million in applications, of which all were viable for $20 million in available funds. So this is an important issue. We're at about 90% penetration across the state of 25 down, 3 up, but every percent from here on out gets harder. And so, you know, I think on one hand, getting more money for our border-to-border broadband program is critical. But of course that takes time. So it takes time to drill lines into the ground and get infrastructure in place. And we're already in a state where distance learning and remote learning are important. So I think, you know, as it relates to finding ways that folks who can't afford the availability of internet that's already there, we talk to telecoms about that and are looking to the kinds of CSR programs they have in place that can help. As it relates to devices, I know that the team at MDH is working with our team at the Office of Broadband to look at ways that we can help there too. But it's a challenge, and I think particularly given some, you know, several libraries aren't open and folks don't have other places to go, you see a lot of folks having to travel to the McDonald's parking lot to do their homework or to do their work, which is a challenge. So we welcome ideas on that front. As an office here at DEEB, we have not waded into the device distribution space yet. We've really honed in on sort of the access to broadband as it relates to our program, but it's a time for new ideas and new ways to get things done. So we'd love people's thoughts on ways we could do more than we already are to get broadband out there.
Thank you. I know a lot of folks on this call have kids who are doing online school, and I just, as you were talking, was imagining trying to do this with my kindergartner with a connection that was not great. And whew, okay, I'm going to stop thinking about that because that's too much. Here is another question for Commissioner Grove. This one is regarding unemployment insurance. And just so you know, this is the top issue by far that MCN is hearing about from our member nonprofits. A little background for everyone. The Federal CARES Act appropriates funds to cover 50% of unemployment insurance benefits costs for reimbursing employers. We at MCN are strongly advocating that the federal government increase its relief to 100% of the UI cost for reimbursing employers. But if the federal government fails to do that, do you anticipate any state relief for reimbursing employers?
Yeah, it's a great question. I will say I think that that's going to have to be a federal government issue. That the scale and scope of such a program to pay back that amount of money is something that I think would be difficult for the state to handle adequately. So I think you're doing the right thing by advocating to the federal government on that front. I would encourage you to continue to do so. And like so many things on this front, I think the federal levers here are so critical to make sure that more money can get into the hands of Minnesotans who are separated from work.
Certainly. And a follow-up to that question, back in March, your blog had a post about partnering with nonprofits, and it notes, during this unprecedented time, we are doubling down on our commitment to our nonprofit partners at DEED. Can you elaborate on what it means for DEED to double down on commitment to nonprofit partners?
Yeah, you bet. I mean, for one, I think just talking more, so being in venues like this matters so that there's information out there, and the 3 weekly community calls that we do is a part of that too. But I think more broadly than that, and I mentioned this briefly before, but for partners for whom doing the usual work plan that they've submitted to us is no longer feasible, or at least feasible at the scale that we would usually request in order to reimburse you for expenses, but you've got payroll to meet and employees that are, that need to be paid. We are looking at ways that we would do cash advances in ways that we usually wouldn't if we weren't in this scenario. So we got to be careful that we're spending taxpayer money wisely and being thoughtful about this, but in some cases that does make sense. And so I think I would point to that, and then also just the basic kind of technical assistance work that we're able to offer in terms of helping nonprofits get to this time is always an engine that's revved up and running here at DEED, and we just want to make sure that it's working as much as possible. And I'll say one of the things been nice for us is, in addition to nonprofit partners, we run, of course, the state's career force system, which is the 50 different brick and mortar workforce centers that exist across the state, and even more importantly, the virtual services. And it's been really good for us as a system ourselves to learn from the innovative ways that nonprofits in the state are delivering services at a time when being in person isn't always as easy, because there are some things you can do over the internet or over the phone or in other virtual ways. So I think part of that doubling down is just learning from each other too, at a time when sharing best practices is so important.
Definitely, thank you. And you mentioned flexibility. I think we have been seeing that as a nonprofit community throughout the different agencies. Obviously, there's, we're still learning, everyone's still learning, but just kind of an overall thank you for making those efforts. On to a totally different topic. What is being done to allow for necessary public health measures, including social distancing in prisons? Are you considering prisoner release?
So I'll take this one. I really appreciate this question, and as someone whose own family is impacted by incarceration, this is on my heart and mind every day. Incarcerated individuals are not often the first thought of vulnerable populations, although personally, for me, they are. But they can be vulnerable to a virus like COVID-19, and I really want folks to know that our administration is taking this threat seriously. Our Department of Corrections is working through numerous strategies for managing prison population that are available within its current statutory authority. So that expansion of work is the expansion of work release, opening up conditional medical release to more high-risk inmates, and the release of nonviolent supervised release violators as well. So that is in the works. The agency continues to work on plans to reduce the prison population and is consistently doing outreach and working with community partners to that end. However, we do have a resource issue, and county supervision agents do not have sufficient funding to take on a significant amount of new work, as well as an issue of ensuring those who are released that they have substantial plans like housing and support. So inside the facilities themselves, DOC is doing all it can to manage the risk. Similar to nursing homes, it's really difficult to simply remove all of the individuals from a congregate care setting. They have managed to get Stillwater down to single bunked rooms, but it's a fairly significant accomplishment if you are familiar with Stillwater. And they're managing the interactions of people within facilities very closely while still providing critical programming and contact with visitors via phone and video. And I want to make sure that we are really clear and transparent about how our correction system is being impacted by COVID-19. The department regularly updates information related to COVID-19 cases and details about their strategies at their website. And I've shared that, or Dom has shared that from our team with Marie, and the website is updated very frequently, especially for family members to know what is happening within each facility to try to manage the support of our community members who are incarcerated, and as well as the folks who come into contact with them from day to day. So this is certainly on our radar, and I encourage you to visit the website to get just more in-depth information about what is currently happening.
That's very interesting. And for everyone on the call, that website is posted in the chat function. I think Sandra posted it at about 11:52, it looks like, along with the Star Tribune piece by Liz Coapola. Okay, we have received several questions that touched on the question of trauma. What is the administration currently doing around issues of trauma, and what are your plans for addressing increased needs for trauma-informed services in the future?
I can take that one. Jody Harpstead here from DHS. Of course, we've all in the sector and also inside of DHS have learned so much about trauma-informed care over recent years. And one of the things I'm, again, very pleased about during COVID here is this recently stood up at-risk populations work group, really working to be sure that in addition to the visibility of our acute care hospital sector, which needs all kinds of attention right now, we're also drawing attention to group homes for people with disabilities, people with mental illness, substance abuse, et cetera. And we're also just today had an opportunity to show the visibility of the 40% of the people on our Minnesota health programs that are at risk while they're staying at home because they've been diagnosed with mental illness, substance use disorder, or seniors with depression. Again, I've mentioned our telemedicine orders that we've put in under our executive order to allow more and more forms of telemedicine, including group therapy, which is awaiting federal approval. I can also mention that the state of Minnesota is awaiting a FEMA grant that will allow for crisis counselors at the State Emergency Operations Center. So we hope that clears quickly and they can start to actually hire people under that new FEMA grant that will allow us to have crisis counselors answering the phones at our State Emergency Operations Center. So with all the things that are still up and running in that space and all the telemedicine opportunities, I certainly hope our trauma-informed behavioral health professionals are fully employed these days and engaged throughout COVID and beyond. And we will certainly be looking for their advice post-COVID because as many of your organizations have thought about trauma-informed care for the people that you have supported over the years, now you're thinking about your own employees, your own organization, and so many of our neighbors across Minnesota who've been traumatized by this whole thing. And so we're going to need all of you and what you know about that to help us recover from COVID and move on from it. So thank you so much for who you are and what you do in that regard.
Thank you. That was a fantastic answer. So thank you. This question, I think we asked something similar last week, but it continues. I think it will be evergreen for a while. This says, with the peak moving into mid-July, what is the most likely timing to lift social distancing requirements, particularly Executive Order 2004? That question came from the Minnesota Children's Museum, and we've heard from a number of other museums who note that any clarity will help their planning on how to financially survive.
Well, I think to be candid, I will give you an answer that is similar to the one that I gave last week because everything is so murky right now in the terms of when we get back to what is considered quote unquote normal. And I'm not quite sure we will ever have a normal again. as this will impact us. But as the governor's been reiterating, there's no clear end date on the horizon at this point, where we know that we'll have the all clear and all guidance will be lifted at once. We saw how the federal government moved quickly away from their open by Easter proclamation. And what we need to know is that we have the proper infrastructure in place to safely reopen. And that question, the questions are really, do we have the beds, the ventilators, the personal protective equipment and staffing? And right now, to respond to COVID-19, and right now the answer is no. And this uncertainty makes it difficult to plan, but we are seeing some of the first instances of countries being able to beginning the process of opening things back up. And you can bet that we're watching really closely what happens in each of those countries and communities. What our administration can commit to is that we'll continue to share the best information that we have when we have it, and that we're working every day to think about how we can begin to loosen restrictions while also maintaining safety. And we'll need your ideas and plans on how we might approach something like reopening museums, especially ones with our littlest Minnesotans, and how we can do that in a safe way.
I think that's exactly right, Lieutenant Governor. This is Steve Grove again. Just to add to that, the governor has asked us in state government to begin to make those plans that the Lieutenant Governor just outlined. And I think if you have ideas, we'll send Maria a link. We have an open forum where we're asking businesses and nonprofits and others to send us ideas on how you could social distance appropriately. And so given the Lieutenant Governor and Governor have asked us to do that, we'd love your thoughts, as she said, and we'll send that form around for your thoughts.
Excellent, thank you. I'll make sure to get that out. I realize we're getting a little close on time, so I'm going to try to sneak in 3 last questions. I have a whole bunch left, but here's the 3 I'm going to go for. We are hearing concerns about the lack of multilingual resources and COVID-related information, including unemployment. What is being done in this area, and are there resources available to nonprofits?
Yeah, I'll just speak for unemployment insurance in particular. We have released all of our FAQs and our application flow in Hmong, Somali, Spanish, and of course English. We'd love to expand those languages as fast as we can. We also have call center employees who speak all those languages on tap to help with challenges that applicants might face in their application process. So please do take advantage of those resources. And in some other cases for languages that we haven't yet translated into, we've got a guide on kind of how to use Google Translate to do that in real time. It's not the perfect solution, but like so many things we're navigating right now, sometimes perfect isn't the enemy of the good. So we're trying stuff like that too. And we'll continue to step up and grow in that area.
And just to quickly build on Commissioner Grove's point, we certainly have been hearing those same concerns, and we formed a community response work group comprised of staff from the governor's office and various agencies to address the translation and interpretation of COVID-19 materials. And as I mentioned earlier, this group also discusses the partnership with community media and organizations to disseminate the information in culturally relevant and connected ways. So far, the Department of Health has distributed $750,000 to community organizations to support the dissemination of information and engage with the community. And there is another $750,000 in grants to ethnic and community media to do the same. So please be sure to connect with the Department of Health to learn more about those resources that will be coming available.
And that you mentioned translation and interpretation, which brings me to the next question. Will you provide ASL interpreters for future press conferences and the COVID daily briefing? The questioner noted that most of their clients struggle to read captions.
Yes, and this is a really good reminder. the governor being self-quarantined really changed the way that we had to go about briefings and presentations. I've already sent this question along to our comms team, so they help us to organize the briefings and press conferences. And the governor will be able to do more video again, and so we'll work to provide important accommodations so that all Minnesotans can get the information that they need from our administration. I'm not sure how it would work on your end, Marie, but if you wanted to put the organization who asked in contact with Dominic,
Sure.
we can make sure that we can follow up directly as well.
Sounds good. I will find that and do so. Thank you. Last question that we can fit in for today. With the recent closure of statewide adult daycare facilities and disability service providers, how will the state ensure that individuals with disabilities will be cared for and protected, including from sexual assault and domestic abuse?
Yes, this is Commissioner Harpstead. Thank you. This is a very good question. I want you to know that last week we added to our at-risk population list the group of people who used to be going to day centers for people with disabilities and seniors who are now at home. And some may not be living in safe environments. And so that's also on our list, and we're paying attention to that. And we are now looking at a proposal to see if there's a way to have some of the day center staff provide some kinds of services in those homes in order to have eyes on the folks that they used to see in the day centers and to see if they can support them through this time. We'll keep you posted.
Thank you. Just a quick thank you from me again for you all being on this call. We really appreciate it. And I'll turn it over to John to close us out.
Thank you, Marie. And thank you, Lieutenant Governor Flanagan and Commissioners Jody Harpstead and Steve Grove. This information was very useful. And clearly, regular communications are essential in a crisis. And we appreciate that this has been done weekly. MCN also has created several resources online in response to COVID-19, including philanthropic resources. We hosted a briefing with the Council on Foundations on fundraising resources, which is still available online. The Council on Foundations has a growing $6 million MCF disaster recovery fund that has been distributed through community foundations and Minnesota initiative funds throughout the state. We've also posted a free resource at our website, a special edition Minnesota Grants Directory that lists over 40 different funding sources that are responding to COVID-19. Finally, tomorrow we have a 400-person conference, which was converted from an in-person conference to virtual, and which grew after we had to move it to virtual. So it's a good sign that nonprofit people are flexible. This is our Finance and Sustainability Conference with Propel Nonprofits, which will be tomorrow, April 14th, and also on the 21st. We'll be joined again by the Governor's Office a week from today, April 20th at 11:30 for the fourth and perhaps the final call in this series, or we're certainly open to more. So thank you everyone for participating. Thank you to each of our speakers, and Nan and Marie, and please stay safe, distance from everyone else. Thank you.